we'll go through some Cochrane statement on certain chronic pain. So, for instance, the psychological intervention of chronic pain, reviewed by the cognitive behavior therapies, usually when they review that, they notice that it can help reduce the negative mood and disability and even pain. However, there are still further guidelines needed in optimal technique and duration and frequency of the treatment. The statement on the antidepressant and the use in neuropathic pain. Antidepressant have a number needed to treat is about approximately 3. TCA being the most studied. SNRI show similar effectiveness like venlafaxine. Further evidence again is required for SSRI, and it's yet still not effective. Carbamazepine is very helpful in neuropathic pain, states up to 66%. However, up to a similar proportion experience adverse events. Condition studies include trigeminal neuralgia and post-traumatic neuralgia and diabetic pain, neuropathic pain. As far as gabapentin in the Cochrane statement and the treatment of chronic neuropathic pain and fibromyalgia, it does provide high level of relief, pain relief, in up to 1/3 of the patient with neuropathic pain, and up to 66% of them reporting adverse event from the drug. Only 12% withdraw because of the side effects. And as far as the long-term opioid use for chronic non-cancer pain, the Cochrane statement was the proper management of the type of a strong painkiller opioid is well-selected patient with no history of substance abuse or abuse can lead to long-term pain relief for some of these patients with a very small risk of development addiction or abuse or serious side effects. However, the evidence supporting that are still needed to be identified, and the conclusion is quite weak. As I said, the long-term studies are needed to identify those patients actually the most likely to be benefiting from such therapy. The use of opioid in neuropathic pain, which is an interesting part, it has a very mixed results in the short trials, and there's some evidence and benefit from certain subtypes of neuropathic pain models in the intermediate term trials. The use of pregabalin in the acute and chronic pain in adults. Pregabalin had actually been proven efficacy in neuropathic pain conditions and fibromyalgia. Minority of these patients have substantial benefit with the pregabalin. More usually will have the moderate benefits, and many or no trivial benefit. So to get back to it, many of them actually have no benefits or will discontinue due to the adverse event. And individualized treatment is usually needed to maximize the pain relief in those patients and minimize the side effects or adverse events. But there is no evidence to support the use of pregabalin yet in the acute pain setting.